So when you were developing Luna, why did you give it the footprint of an ALIF, and what benefits does that provide?
An ALIF footprint is really ideal. It covers so much of the end plate that you decrease the chances of subsidence for two reasons. One is you're covering much more area, but two, it really covers the area that is the strongest part of the end plate, way out laterally. The middle is softer. So in designing Luna, we wanted to recreate that, but we didn't want to go through the abdomen and have to do all the bowel retraction and have the risks of injuring the great vessels which are covering the disc spaces all the time. So we wanted to create something that would be like an ALIF and give us a large coverage of the end plate, be sitting on the strongest part of the bone, but go in like a TLIF. Dave, during residency, you had obviously done static cages and expandable cages before we introduced Luna to the operating room. What's your comparison of those three kinds of cages? What did Luna impress you as compared to those other cages?
So during my residency, when we were doing static cages or typical expandable cages, it had such a large footprint, and the disc prep is so great and so simple, and I felt like we were getting a very strong supportive cage in there that wasn't going to violate the end plate and subside.
I'm glad you brought that up. In the first generation of Luna, we were just using standard disc prep instruments. And one of the issues was getting enough disc out of the contralateral dorsal part of the disc in order for the Luna to be able to make its turn. We developed Orbit, which is the most impressive discectomy device I have ever seen. And it'll do a complete discectomy in minutes and absolutely gets the contralateral dorsal side. What are your thoughts about Orbit?
My first thought about Orbit when I saw it was that I wish I thought of that, because it's so effective at what it does, and it's so simple.
So what we do know is that when we're talking about creating a construct, that we want to look at the actual sagittal alignment that a patient has. The construct has to be strong between L4-5 and L5-S1. That is the primary driver of your lumbar lordosis and overall sagittal balance. Luna, being an ALIF through a TLIF approach, allows us to get that ALIF style footprint at L5-S1, giving us a very strong base to build, but also gives us a great degree of lordotic correction in order to drive lumbar lordosis and sagittal alignment.
So my name is Uzandu Agachukwu. I was born and raised in New Orleans, Louisiana. I went to medical school at Indiana University in Indianapolis, and then I did my residency out in Seattle. And the first time I tried Sapphire X, I was certainly blown away. I have in the past utilized standalone implants in the cervical spine. They're only indicated for they're not indicated for more than 2 levels, right? The reason being is that you can certainly see catastrophic collapse because you don't reconstruct the ALL, right, with those standalone implants. Your implant is within a disc space. So if you have subsidence, the spine can go into kyphosis, which certainly is an issue. I see a lot of that, unfortunately, in my practice, not necessarily my patients, but patients I take care of, and they require deformity correction procedures. And if we can treat them, with an implant, similar techniques in terms of treating one level independently, I thought that would make a difference. And so when I used Sapphire X the first time, I did my normal exposure. I did my disc prep like I normally would do, and then I put the implant in, and then the plate slid down. There wasn't a challenge getting that plate, getting the plate to line up. Sometimes when you have just a plate that's not attached to the inner body, even just for a single level, it can be a little tricky getting that plate to sit where you want it. You oftentimes have to pull out a screw and manipulate the plate to get it to sit the way you want it to sit. And so, with Sapphire X, I didn't have to do that. I was able to, put my inner body in, drop the plate down, and put the screws in. And I thought it was just so simple.